We will flash out the Slido again so that you can push out your question. Can we have the Slido slide? Yeah. All right, so we have raised some questions. So you can still key in your questions, all right? Well,
so should I see?
Yeah, you see that? Come. Yeah.
I'm afraid I get a dizzy spell turning my head so much, you know.
Lama, you just look at me, yeah.
Look at you.
Yeah, just look at me.
I might have a more dizzy spell.
I'll look up the question for you. But
just kidding.
Yeah, I thought I'll start by asking you a question first,
okay.
And then we let the Slido. The rest of you can push out your question. All right. So I thought since you share with us quickly, I just do a quick recap for all of us. All right. You share with us about the need for lay ministry. All right, because there's not enough professionals. You can train all the professionals in the world. It will never be enough for the pandemic and the crisis. And Dr. Tan shared with us about the biblical foundation for lay ministry, and then the need for us to start with understanding the basic view of humanity. He shared with us about the 14 principles for effective counseling, and finally he ends with what the church can do. So my first question for you will be, how do we engage, because today the crowd mainly are pastors. So my question for you will be, how do we engage the mental health professionals in our church? I mean, they may tell us, well, I've been working from Monday to Friday. You want me to serve in church? Very tiring, no? So how will we engage the mental health professional?
Engage, that means get the mental health professionals in the church, be involved in church ministry and so on, yeah. Well, first of all, you need to know who they are, right? Some of you don't know that you have a psychiatrist in your congregation, you know? If you have a psychiatrist or a psychologist in your congregation, say hallelujah, okay? Because they're in your congregation. So get to know them, take them out for lunch, say, hey, can you collaborate with us? So a very practical thing as a senior pastor, I happen to be a psychologist myself, so I double the role, so I do it myself because I'm trained to. But sometimes somebody else who can do it, they're expert in an area I'm not expert in, like addictions or something, then ask them to do a workshop. You can have a workshop on coping with depression, a workshop on coping with anxiety, a workshop on coping with addictions, okay? A workshop or a seminar or something, or even Sunday school class on, so-called emotionally healthy discipleship and so on, or a parenting class, okay, or stress management, okay, or enriching your marriage. You follow? All these things, the mental health professional can come and talk, or just understanding mental disorders. You know, a psychiatrist especially can come and talk about medication, side effects, and all that kind of stuff to educate your members, as well as to destigmatize. You see, that's the key thing, to destigmatize. And then, so that's the connection with the mental health professional and the pastor. And then as a pastor, if you're not trained in the clinical counseling field like I am, okay, not every pastor, very few pastors are trained like people like myself, where we have dual training, all right, or experience. So you go and consult a psychiatrist, psychologist, a friend, give you some information, some books to read, you see. I gave you a lot of books just now. Then preach a series of messages. I've preached at least 6 in my church. Okay, mental health in the church, depression. Mental health in the church, anxiety. Mental health in the church, addictions. Mental health in the church, loneliness, anger, okay, marital issues. I preach a whole message, 45 minutes on that, from the pulpit, so that people are listening, you know, and it blesses the church. Okay, so that's some of the ways that we can, and then referrals, of course.
Yeah. So referrals. First of all, we need to get to know the mental professionals in the church first, lah. So build the relationship before you engage them to serve. Okay, so let me just look at the most popular question now. What kind of supervision will be needed for lay counseling?
Okay, depending on the level of lay counseling, I didn't have time to talk about that. Tomorrow, I'm doing a 2-hour seminar on, I forget the church name, Chapel of Christ the Redeemer. It's an Anglican church, okay? Yeah. They asked me to do 2 hours of training on lay counseling. But I know some of you mental health professionals here who are experts in training lay counselors. Some of you took some courses with me or some training with me. So there are people in Singapore who can do all this, okay? And many organizations do all this, all right? So they can train you. But you need to, first of all, define what lay counseling is, what level, and what type, you see, and what model. You can have informal model like Stephen's ministry, you know, you just go and visit people and makan with them and just talk to them, more informally, basic level of caring. But even Stephen's ministry, the founder of Stephen's ministry, Kenneth Hogg, he has 50 hours of training. That's not basic, that's a lot. Some basic levels of lay counseling, just 30 hours. Like my model has 36 hours. His is 50, that's quite a bit. But you can train people in 5 hours, just one weekend, just in terms of lay caring. Visit, hey, how are you, how to listen, and just pray with them. Simple. That's lay caring in counseling, but basic level. You go to another level where it's deeper. You help them to change their thinking, help them to change their behavior. Then you need more hours of training. You're not trying to be an amateur shrink, okay? Lay counselors are not amateur therapists. They are counselors, caregivers. But they might need another 20 or 30 hours of training to know how to go deeper with people and how to differentiate the levels of severity of disorder and how to refer, okay? And then after you do that, once you start them, they need supervision. So the basic ones, maybe once a month, get a few of them together, see how it's going, but keep confidentiality. The ones that are involved in deeper levels of lay counseling, you might have to have supervision more than once a month, maybe once every 2 weeks, maybe once a week. And you might even need a one-on-one supervision, or 1-on-5, or 1-on-4 small group supervision. Some supervision needs to be provided, just to make sure that things are going okay.
Yeah. Thanks. So we start with scoping the skill level before we build it
yes.
up.
And then the next question is, who's going to do the supervision, right? Does it have to be a mental health professional? In the States, I hear all the time, it has to be a licensed mental health professional, because we have many in the States. I will speak up. I'm supposed to be the expert on lay counseling, okay? So I tell them, why do you have to be licensed? Or don't you think they need licensed mental health professional? I say, you're talking about bigger churches. How about my church is in Montana, in Ulu land? Okay, Montana is not Ulu land, okay? But you know what I mean, okay? My church has 50 people. There's no mental health professional within 2-3 miles, or 200-300 miles. But I have a pastor there who has some training in biblical counseling, at least some more experience. He can do, or she can do, the supervision. You see what I'm saying? So the supervisor does not have to be licensed, does not have to be professional. But it will help if the person is a professional, not essential. So probably a pastor or pastoral care supervisor. Yeah.
Good. On this note, let me just highlight the lanyard for all of you. All of you are wearing black lanyard, you are pastors or ministry staff. Then you just look out for those who are non-black. Right?
Oh,
so they are available, they're just around you, okay? So remember I asked you to find out 3 persons. All right, look for those who are non-black and come and see me later, okay?
Oh, that's why this is different, the color scheme.
Yeah. Okay. So for us, we are organizer, yeah.
All right.
Okay, now how do you differentiate a medical condition from a spiritual condition?
Between what? Mental illness and, what's that? How do you differentiate medical condition from a spiritual condition? What are the next steps? Or how do you differentiate between mental illness and demonization? It's very similar, right? No? Medical condition from a spiritual condition, okay. Well, that's a little different, but I'll answer this question first. Usually, if someone is struggling with a spiritual condition like spiritual struggle or spiritual dark night of the soul and so on, their symptoms are not as severe. They might feel a bit down, a bit low, a bit empty, but they are not like bedridden, suicidal, cannot eat, cannot sleep. They don't have the severe symptoms. But they have spiritual struggles, so you need to ask them, why are you struggling? Because I'm struggling with the goodness of God. I'm suffering so many things in my life, I don't know whether God is with me. And recently, I feel that God is not with me. I cannot feel His presence. But I love the Lord. I really want to grow deeper in Christ, but suddenly I feel that He's left me. Then you have to counsel them that, no, God doesn't leave you, but your sense of His presence might have left. So that's the dark night of the soul. And you assure them that it's normal. It might take a few days, a few weeks, just hang in there. Exercise, just continue the normal things, and just trust the Lord. Wait, I'll pray for you, I'll pray with you. We'll meet once a week just to make sure you're okay. And then usually after a week or 2 or 3, it passes by. They get better on their own. They don't get worse. You don't need a mental health professional. If it's a medical, actually it's not medical, mental condition or medical, okay, it will, the severity will be bad. It usually gets worse over time, right? And so you need to intervene, and the symptoms get more and more severe. Okay. So they are severely depressed, they cannot function, okay, their functioning is affected, they cannot eat or sleep properly, and then they have, sometimes the worst thing is, they have hallucinations and delusions, things that are not there, they see, and so they get psychotic, or they get very highly suicidal. Now it's going beyond the spiritual. So you need to consult with a doctor or a therapist or a counselor. Are you with me? Huh? Now, should I answer the next question about mental illness versus demonization?
Because we have another forum later where I have a psychiatrist that will be answering that question.
Oh, okay, good, okay.
I thought we ought to go straight to the pastor one. What is the pastor question that was? If I, as a pastor, is generally depressed and have much stress, how open can I be open to the church, given our Asian Singaporean culture, which still considers such admission as weak?
That's a very good question, okay? It's a culturally sensitive question. In the United States of America, among the white churches, especially the Western churches, let it all hang out. Sometimes you hang out a lot of stuff. Let it all hang out, Be real, be transparent. So you come to, something, folks, I'm going to be real with you. I've been a senior pastor for 20 years. And I had a really bad depression for the last 2-3 months I never told you about. I went to see Dr. So-and-so for therapy. I went to see Dr. So-and-so for medications. I'm on an antidepressant. I'm on cognitive behavior therapy. It's helped me to be more stable right now. And now as your senior pastor, I want you to know that I suffer from depression. And you must not have stigma. You must go and see a psychiatrist. You must go and see a therapist. Okay? And everybody clapped for him, you know. It's a white church. Huh? You do that in an Asian church, huh? Wow, this guy like that. That's my pastor. Hey, maybe he's suicidal. No, I better don't trust him. So I had a Korean guy on a faculty. Recently, we had a consultation, think tank, the Church and Mental Health. And it was very, very, what shall I say, in quotes, almost proud to say, from my pulpit, as a Korean American pastor, I've told my congregation many times that I suffer from depression. I've been having psychotherapy for the last 6 months. So all the white people and some of the black folks said, oh, that's good, Asians trying to learn to be more open. I sat there as a psychologist and pastor, I had to bite my tongue because I have to be careful. Siang-Yang Tan have to be careful not to be smart aleck. So I kept quiet, I pray, and then I say, cannot, the Holy Spirit, better say something. I said, my friend, it's very, very honorable what you have done. You're from Korean church. Korean church is even more conservative than Chinese church. But I am the pastor of a Chinese American church. We have Cantonese, we have Mandarin congregation, we have English. They're all somewhat different, you know. So I said, I will not say that. He was shocked, you know, because everybody was so happy, I almost clapped for him. Then I can contradict him. I said, I'll be very careful before I say that. You can say that to small groups, 1 or 2. But a congregation of 2, 3, 4, 500, people have different levels of understanding. And you let them all hang out. You let too much hang out, you might hang. Right? So what do? You learn to use wisdom. You can say, for example, you know, guys, we all struggle. I sometimes struggle with down moments. I sometimes struggle with some anxiety, you know. But I trust the Lord. I talk to a friend, I ask for prayer. And sometimes you might need some medication. You can say all that. You see, notice the way I share? Briefly, vulnerably, but not too many details. You see? And whatever you do, do not give your congregation the idea that you're cuckoo, right? They cannot trust you anymore. Then you lose your congregation. So don't be stupid. Singapore has a little video, right? I'm not stupid. I hope that helps. Is that okay? Is that a culturally sensitive answer?
Yes, so what you are really saying is that there's a need for nuances in the way we release, because the congregation is a mixed group of people, and they are at a different level of maturity. Yeah. So while we want authenticity, we want honesty, we want to destigmatize, but there's a need for nuances in how we say it. Yeah, I guess that's what you're trying to help.
And we're talking about Asian congregation here, not white congregation, where even the white congregation, there's still stigma, but less than in the Asian or Chinese or Korean congregation. You follow? So stigma takes a long time to overcome. You don't just let it all hang out. You let it hang out bit by bit. Slowly, you see, then gradually they'll become more comfortable. Okay?
And then especially with the new emerging generation, they may be more ready.
Yes,
as compared
exactly.
to the
depends on the generation too. Yes.
Correct, yeah. Okay, so sometimes the helps from members can be very unhelpful, but they refuse for feedback.
So you mean some of your members try to help people, but they're very bad, right? Give bad advice, they interfere and so on, right? But then they are doing it on their own, right? It's not because you as a pastor ask them to do. If your lay counselors are like that, you got to stop them in your supervision, you know, and say, you better take a break from lay counseling until you straighten this out, okay? But if they're doing it on their own, you cannot stop them per se, okay? Unless the member they're trying to help complain to you, hey, pastor, please talk to this person. It bothers me, calls me 5 times a day and tells me all kinds of advice that makes me feel even worse, you know. Can you please stop him? I told him to stop, but he will not stop calling. Now that's different. They're asking the pastor to intervene now in a conflict situation. Then you have to intervene as a pastor. I'll call that person up. I say, I know you're trying to help. I know you're trying to be helpful, but this is not helpful to the person. So you need to respect their boundaries. You must stop calling them. So just because somebody tries to be helpful doesn't mean that the person ends up being helpful. That's why we may have to learn some basic counseling skills, you see. So in your sermons, in your teaching, in your Sunday school, in your seminars, you educate your people in terms of how to listen. Don't give advice too fast. Okay? Remember what I said today? Very simple, right? But it helps. Explore and understand before you act. And that usually means you listen for the first half an hour or more. Really? Yeah. And then paraphrase, summarize, support. And then at the end, give a few words of direction, if appropriate. Are you with me? People need a listening ear more than anything else. Most people struggling with problems know what they need to know. Know what they need to do. They just cannot do it, you see. And they don't feel understood by people. So if you just listen to them, why they have the panic attacks, why it's not because of sin, not because not enough faith, not because of anything else, but it's just hard. Then they feel someone understands them. That itself is healing. That loving acceptance is healing. And then they might be willing now to go and seek some help. Especially if you're a lay person or pastor, right? You're not a professional, you can be more flexible in your boundaries. So for example, a pastor or a lay leader can say, hey, Mr. Wong, I go to the doctor with you. I drive you. I know you don't have a car. Take a Grab. Is it Grab? Grab. Okay, Grab. In the States we say Uber. Okay, and I'll be your Uber. I'll drive you there. I'll wait for you in the waiting room. Don't worry. You come out. We pray about this. This is a good doctor. He's from our church, or he's from some other church. He's a Christian, right? So you reassure them. You support them. You go with them. You come back with them. You don't abandon them. You still check in with them. You still have lunch with them. You still pray for them. You see what I'm saying? That's how the church cares, you see. Okay.
We have time for one last question,
okay.
Because if I don't ask this question, she will nag at me throughout the rest of the evening.
Okay.
Please give us some handles on how best to equip all members to exercise burden carrying, collaborate or team up with professionals to journey with those in crisis. Yeah, so give us some handles.
Where is this? Please give us some handles on how best to equip all members to exercise burden carrying, collaborate, team up with professionals to journey with those in crisis. Give us some handles. I think I've given a lot of handles already, right? You want some more? I don't exactly understand what you mean, but the handles are to work in collaboration, to conduct those workshops and training sessions, okay, and to release lay people to care for one another, and then to consult professionals when you can, get the professionals to do some of the training for you, and pastors and mental health professionals should actually get together on a regular basis. My suggestion is that you guys should get together for lunch once every 3 months or so. 3-4 times a year, get in touch with your psychologist or psychiatrist or counselor in terms of buy lunch for them, pastor, talk to them, ask them for some input, and if they're humble enough, they will be very helpful. And then you pray together, you see.
Yeah, on that note, I'd like to just publicize our prayer meeting. I have a prayer meeting with mental health professionals every month. I'll let you all know if you're interested, can join us. We meet together to pray and to share about what the various ministries are doing, so
Very
that
good.
you can get to know more. Yeah.
By the way, I know we have to end. I'm serious here. I'm not trying to flatter you guys. I haven't been back to Singapore for about 3 years, okay? In the States, I'm very involved in this mental health and the church thing, okay? I've been very impressed with what you have been able to do in Singapore to date. The organizations here. Seng is not boasting, just sharing. I say, wow, you have this prayer meeting? Wow, you have this? Wow, it's amazing. And some of the things just happened the last 3, 4, 5 years, What I'm saying to you as Singaporeans mainly, okay, is keep it up. You're doing a wonderful job. God bless you, okay? And you have my full support. And you want me back to speak again, I will come on economy class. Okay.
Can we give a big hand to Rev Dr. Tan? Okay.